Audience, welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary medical issues. Today we'll be talking on autopsy. My name remains Dr. Femi Ogunremi, and I have with me Dr. Kazeem Ibrahim, a consultant, can you imagine? A consultant pathologist who will be taking us through everything about autopsy today. You're very much welcome, Dr. Ibrahim.
Thank you, Dr. Femi Ogunremi. You're doing such a wonderful job. I'm Dr. Kazeem Ibrahim. I'm Associate Professor of Pathology, University of Ilorin, and a consultant pathologist, University of Ilorin Teaching Hospital. I'm supposed to do justice to the topic, and I welcome the viewers from all over the world.
Thank you so much. We know that, in Nigeria, comparatively, autopsy or examination of the body that you're going to tell us is a big issue. I really want to learn from this today, and I know that the audience wants to engage with this as well. In the other part of the world, it's something that is quite, robust. We never have to issue, death certificates unless we know the cause of death. And cause of death can be very tricky sometimes. And I know that's the time that we have to talk to the coroner, we have to talk to, the pathologists. So it's a very welcome, topic today. And then we will really appreciate the justice. For the people, for the audience and people watching us, what is actually post-mortem? What is post-mortem?
Thank you. Post-mortem from the word means after death. So you have to add the word examination for it to make meaning. Because post-mortem means post, after, mortem, death. But the autopsy, the real meaning is post-mortem examination if you want it to be complete. And that is examination of body after death. So the question is, why are we examining a body that is dead? There are several reasons, if I want to explain why we're doing that. Is first to confirm that a death has occurred. Because not in all situations that that you have somebody to confirm that there's a death. Okay, so you want to know what caused that death. In addition, you want to know what are the injuries or the diseases that led to that death? Okay, you want to know what are the mechanisms of the death, because we learn from that. And you want to know, the circumstances surrounding the death, especially if it is death in suspicious circumstances. So by and large, that is like the general, overview to laymen, the meaning of postmortem examination.
Thank you so much. So what people will be thinking, in our environment, when somebody dies or when a death has occurred, we're very sacred about it. Where, people are very sacred about the body. And a lot of people will say, why are they mutilating the body? Somebody who is dead is dead. You understand? Let them rest in peace. I know you talk about, you briefly mentioned some of the reasons. Can we let the audience know why it's actually important, for us to examine the death before we go into other questions?
Well, let me use this opportunity to, educate the audience that basically there are two types of autopsy. Okay, the one, one of them is clinical autopsy. And in clinical autopsy, the patient is being managed in the hospital, death occurred, and the clinicians want to know, the circumstances. Why did this patient die? The clinicians deserve to know. They have given the best to the patient as far as they are concerned, and they are worried that this patient shouldn't have died. Okay, so they decide they need to know what happened, because they need to learn from that so as to help the other patients that they are managing. So that is an example of one type of autopsy, clinical autopsy. The other one is medico-legal autopsy. The state is interested. The state in this sense is the government. You know, you don't own your body. People think they own their body. They don't own their body. You can harm, if you harm your body and you are caught, you'll be, you know, prosecuted. Talk less of if you kill yourself. So any death in whatever circumstances that is not clear to the government must be investigated. And that will fall under the jurisdiction of medico-legal autopsy. So people will ask, why do we still need to cut the body? You know, there's this general purpose of autopsy. We learn from examination of the dead to take care of the living. That is the sole purpose. We are examining the dead to learn on how to care for the living. If Dr. Femi, if the earliest scientists didn't, you know, cut the body, examine the organs, there wouldn't be medicine. So autopsy, you will learn a lot from the dead just to take care of the body. That is the summary, you know, of the purpose.
Wow. So now you talked about the clinical autopsy, and you talk about, you know, the medical legal autopsy. When you do, maybe we'll take them one after the other. For the clinical autopsy, it's important for us to know the cause of death. Okay, so what do we do with this? Why is it so important to actually know the cause? Okay, you mentioned for the knowledge purpose. Now, for the medical legal aspects, who requests for this? The government, and then if they request for that, what do they then do with you know, the report that you're generating from here?
Thank you. I want the audience to get, if they want to get one thing from this presentation this morning, is to know why the doctors are requesting for autopsy. Okay, and the main reason is the death has occurred, right? But if you don't learn from that death, how are we going to be ensured that we give the maximum care for the next patients? So they have given their best, but the patient died. So they can't just assume that I've done my best and the patient is dead and there's nothing we can do again. Let's learn from this death so as to, you know, guide us in management of, you know, future cases or similar cases. That is clinical autopsy. But the medical legal autopsy is the one that has to do with the state. Let me give you an example of medical legal autopsy. Suicide is a medical legal autopsy. Road traffic accident. People will want to ask, road traffic accident, why are you doing autopsy again? Okay, Dr. Femi, if you don't do autopsy to examine the causes of death in majority of our bikers, the people who ride Okada, to know that the cause of death is actually head injury, how will you tell people to be putting on helmet? You understand? A death has occurred. You said road traffic accident. Everybody knows that this person is dead, is accident. But what are the mechanisms? What are the things that actually cause this death? You know, the Western nations did not just wake up and say people should be putting on seatbelts. They didn't wake up and say people should be, you know, they should provide safety measures in the cars. It's when they examine the causes of death in these road traffic accidents, and they now realize that if you put this on, you can reduce the death resulting from these crashes. You know, that is the extent to which we, you know, we gain from doing medical legal autopsy, apart from all that, you know, reasons which time may not permit us to mention.
Thank you so much. So now let's go into it. When we do, you know, people want to know, you talk about, you find out, you know, causes of, you know, death in circumstances. What do you do to actually do this? What are the processes that you get to want to see through your eyes? What are the things that you do when you do this autopsy?
Okay, Dr. Femi, thank you. Let me discuss extent of autopsies. The first level is for doctor to just examine the body without cutting the body.
Right.
Sometimes if there are limited resources, personnel, you understand, that can be permitted. But there's limitation to which you can use that, you know, general body examination. If time permits, I will explain later. Another level is limited autopsy. What we call limited autopsy is that you won't check everywhere, just open that particular part of the body that you are interested in and carefully, take the body back. People may not even know that autopsy was done. That is a limited autopsy. And I will give you an example. A gunshot injury, you see the entry point, you see the exit point, and you just want to know which organ are damaged by this bullet. You just carefully check the trajectory of the bullet just to know the organs that, are damaged. That is a limited autopsy. And the full autopsy that you have to check everywhere, even including collecting tissues, collecting specimen for forensic studies. So that is the extent, you understand? And if I may use a few seconds to explain the extent, the importance of the extent of the autopsy. Dr. Femi, imagine this, an old woman with a fat investment, insurance, cover, you understand, running into hundreds of millions of dollars, just died suddenly. The insurance company will want a full autopsy because of the money they are going to give to the family. You understand? So when you see that death certificate, there are areas in that death certificate that will indicate whether autopsy was done, whether autopsy was not done, and that will determine to what extent the people that are going to rely on the, the genuinity of that death certificate will determine the extent to which, they examine this body before they issue this death certificate. So there are extents of, autopsy. And it depends on sometimes what the family wants. The family may say, we just want to have an idea of, okay, so we don't want the entire body to be cut. And so we do, if we can get important information from that limited autopsy, we limit ourselves to that, scope of autopsy. So there are scopes. You can just examine the body without cutting. You can do limited just by cutting the, open the skull and see the brain without checking other places. Or you can do full autopsy that will even include, forensic studies. Thank you.
Wow, thank you so much. So, I mean, your job is quite an interesting one, and I'm sure people are looking at you like, oh, right. So how often do you have to do this in our society? How often do we have this done?
There's a decline in the rate of clinical autopsy. And this is the pattern. Lagos State in Nigeria has a perfect, coroner policy, such that you can't bury any dead in Lagos without evidence of certification, evidence of some kind of autopsy. That is Lagos State. But if you go to the far north, people want to bury immediately for social, religious, religion reason, cultural, reasons, and people want to bury immediately. No room for autopsy there. If you now come down south, as you come towards the south, you are having some, progressive increase in the, the rate of autopsy. In Ilorin, where I practice, clinical autopsy is very, very, very low. What we see most are this coronal autopsy. And in coronal autopsy, like I told you, the family has no say in coronal autopsy. The government, the state in this instance, wants to know why did this patient die. The state is interested. So that is why coronal autopsy, we still do coronal autopsy, but we have very few cases of clinical autopsy. Thank you.
Thank you so much. Now, I want to put my hat on as a medical doctor as well. I know that, we learn a lot from so many things, and obviously the path that we set, the rules that we set, the management that we set is based on the understanding from the past. I look at Nigeria, health system. We have issues, and I'm just looking at, the fact that you just presented now, whereby we do not have engagement of the public reasonably in cases where people die. So a lot of the time we bury people, we issue death certificates. I don't know what we put in the death certificate when we're not even sure of the actual death, because this happened a lot. In fact, on a personal note, it has happened to me when my father died. So I know that in England, for instance, there's no how you bury anyone unless 2 doctors had actually certified. You know, one will write the death certificates. In fact, 3 doctors. One will have to go and examine the body to see if death is occurred, and then you then have the final doctor that then looks at it and then vet it that this person is dead. And then we need to know the cause. We're able to audit that, okay, this number of people have died from these particular diseases, and then it tells you what's actually common in an environment. Where I'm going to is, how do we, because I'm part of this now, how do we now manage situations that we're going to learn from this? What can we get the audience to, to hear and understand about this is your job, which is very crucial to medical, understanding of situations.
Thank you. We've done a lot. We've tried in Ilorin. We've done a lot. We've called stakeholders on how to improve, the rate of autopsy. But Dr. Femi, let me say this. Even outside Nigeria, the rate of autopsy is declining generally. And what is causing this decline is because of the improvement in the radio imaging technique that made people to have, very sound information about the diseases even before the patient died. They know almost everything, you understand, by investigating the patient. So in that situation, when the clinicians have this much information about the diseases before the patient died, they may consider it, what else do we gain from autopsy? I'm talking about clinical autopsy now. They've done almost everything. They have seen what has happened to all the organs using radio imaging techniques. So the question is, what do we do now? But in our own environment, you know us, and you know how we take death. Depending on the part of the country that you have. In fact, if you fake death, you are interred already in some part of the country. So people want social, cultural, religion, you can't, there's nothing you can do about it than to continue to engage the population. And how do we engage the population? If you don't, sometimes, Dr. Femi, sometimes an infant is dead or a child is dead, and you want to convince the parents, you may sometimes need to tell them, Madam, if you don't do this, you may not know what may happen to your next child. The next child may suffer the same thing. So let's do this so as to know what to do in case you have another child that is behaving this way. Like I said, we examine the dead with the mindset to take care of the living. So we cannot, but continue to engage, the populace on the need to, to do this autopsy, especially if we are not clear about the circumstances of the dead. Okay, we'll continue to engage the populace. Thank you.
Yeah, thank you so much. This engagement also, I think it hinges on quite a lot of factors around us, because that leads me to the next question I was going to ask about, the beliefs, the myths around this kind of, examination that we're talking about. What are the common myths that you found or that you've seen among our people that you think might be causing the resistance? Maybe that you might need to just talk about and let us, see whether this will also unblock some people's minds.
We'll talk about that we're going to mutilate their bodies. That is the first concern. That the dead, the way people take care of the dead, you will not believe, that the individual is dead. Okay, and they will not want anything to touch that dead body. But as a pathologist, as a scientist now, I want to believe that the life is gone out of the body, and the body is just the body. That if you live like that, it will turn to dust. I mean, okay, so whatever we can do to learn from that body, to improve mankind, and advance science so that people will live long, I think the population should, accept it. So the first issue is about the mutilation of the body. Another issue is that the body is dead and what are you doing again? And, sometimes you didn't do what you're supposed to do, especially in circumstances where the relatives felt that, enough attention has not been given to the patient when he or she was alive and now dead, and you now want to do autopsy. they will not want to allow you to do autopsy. Also, religious concern. I practice in Ilorin, predominantly, I say predominantly, Muslim, city. And whenever we tell them that we're not going to delay this body, if you give us consent to do this autopsy, within hours we'll do it and you can take the body for burial. So that also, they don't want the body to be delayed. People have the belief that they will live another life, that whenever they come the next life, they don't want their body that has been mutilated, thinking that they want to be complete by the time they are interred, so that they will, wake up complete in the year after. Those are the concern of people, why people, want to reject, autopsy generally.
Yeah. Right. I have a question here from the public. Does clinical postmortem attract any financial implication in our hospitals?
Straightforward question. No. Clinical autopsy is very, very free. No fee at all. Is required for clinical autopsy. It's very free. Okay, Dr. Femi, let me use the opportunity to talk about death certification. Just a few seconds.
Just
death certification. There are levels of death certification. In fact, that a doctor is seeing a dead body can certify that this body is dead. And that is a form of certification, death certificate. Like I said, it has a level, depending on how you want to, what you want to use that death certificate for. Yeah. If you want to use that death certificate to claim millions of dollars, it has to be done by very, very experienced pathologists that must have checked everything to be sure that there's no foul play. So part of death certification is that a death has occurred. Part of death certification is that I know what caused this death. Part of death certification is that autopsy has been carried out on this body. You understand? So it has a level. So we wouldn't say that without autopsy, you cannot certify that a patient is dead, or you cannot issue a death certificate. Thank you.
Thank you so much. So to the audience, I think this is, to me, it's going on well. I think I've learned. In all honesty, I didn't know that, postmortem doesn't cost a dime in the hospital. Well, maybe anywhere. Anyway, I didn't know that. So that's a very important information to let people know. So I think you said something earlier on, and I want to touch on it. When people think that their ward has not been attended to during admission, and then they die, and then everybody's angry, and they say, "Oh no, we're taking our body away, and we don't want to." I've had this situation in Nigeria here where somebody came to me and said somebody died, and just told me quite a lot of things about things that didn't go right from their own perspective, and I could relate things with them. But then when this lady died, what the family did was, we're angry, we have to take her body. They took the body, and it was the process when they took the body. I was in England then, and they called me and I said, "Look, I think this lady you need to have a postmortem. If you think what you're telling me, if it's right, this lady needs postmortem." There was nothing that was not said to this family. They went and buried this lady. And then after they buried the lady, they started arguing and they wanted to go to court. And there was no evidence. You understand? And in the end, the whole thing was thrown away. And they felt, oh, they cheated us. They did. I said, no, you didn't do the right thing. And I think sometimes people don't understand some of these things that you are talking about. Thank you so much, because you've actually thrown light into that extensively. We will be getting to the end of the program very shortly. What would be your advice generally to individual and to the governments relating to your work, especially around this autopsy and then post-mortem examination?
Thank you. I want the public to believe that deaths sometimes do not just occur. You understand? That it may be necessary to investigate death. What you think that is natural may actually not be natural. And if you don't do this autopsy to unravel the mystery behind some death, we will never learn from it. Let me give the audience one scenario before we close. Okay? Travelers before the advent of electronic banking, you know, they have the money with them, travel, you know, in a commercial vehicle, accident occurred, claim to have occurred, bodies burnt beyond recognition, okay, no investigation. You think that the accident naturally occurred. But if the state investigated, as it has happened in the past, they realize that they actually robbed these, you know, traders, you know, fake the accident, you know, and put the vehicle on fire. So if autopsy was not done, how would they know that that happened? So it is difficult to believe. As pathologists, we don't believe anything until we have examined the body. So it is in that light that I want the general population to know that postmortem examination is not a bad thing. Sometimes even a body that is buried, sometimes exhume, as you know, sometimes exhume, you know, a buried body to actually investigate the circumstances surrounding the death. So people should be free. Autopsy is free in the hospital, in the clinical setting. And medical legal autopsy, I don't think, depending on the level of the autopsy, the fee is not, you know, throat cutting. Thank you, Dr. Femi.
Thank you so much. And then for our government, because I know that charity will begin at home, and then we need to, you know, you need to give a word. What do we need to do? Our system is chaotic. We don't have a system. I know Lagos State has the policy that you cannot actually, you know, you can't bury anybody without a death certificate here in Lagos. But at the same time, there's still a loop, you know, there's still a lot of loopholes where situations where people really need to have autopsy. People still find their way around things. How do we tidy this up?
You know, my advice, you know, is for the government not to be political about health issues. There's a lot of politics involved in health issues. And I don't want to mention a state in the North Central now that, you know, we're having COVID issues. I don't want to mention the name of the state. There are a lot of political issues in, you know, related to it, and it's affecting, you know, the health of the citizen. Such that if the government realize that by doing this, they are going to lose the, you know, popularity, you know, they will not want to go there. And I think it's only the Lagos State and I think Rivers State that, you know, took the bull by the horn and say what is good for the population is what they are going to do. And they have that policy. So my advice to the government is that they should be bold, they should be courageous to have the policy in place, even whether the populace will not like it initially, but it's to the benefit of the populace at the end of the day. Thank you very much.
Thank you so much for this exciting, you know, delivery. I mean, I've learned a lot. Somebody is still doubting it that autopsy is free in our system. Yes, it is free. That's what we're hearing from somebody who is directly involved in this now. Even me, I'm shocked because I didn't know that it's free actually. So we really appreciate you coming today. We thank you for your time. I know I'm not taking this for granted because what you've done, or you people that come on the station, we don't pay you, just to let people know it's not a paid service. They come at their own volition and you know, to freely give. So we really appreciate you so much, Dr. Kazeem Ibrahim. To the audience, you've had another session today, and we've talked about autopsy, we've talked about postmortem examination, not just postmortem again. So there's been a lot I've learned from this, and I really appreciate it, and I hope you have learned as well. So next week, we'll be coming up with another topic, which I'm sure you will benefit from. And while we just round up now, I want to say, please, remember COVID is still around. Anyhow, continue your safety measures, you know, face masking, distancing. I know that we have the vaccine that has just come around. Before you get your vaccine and things like that, should continue to do all these things and have a safe weekend. Thank you so much. And God bless. Bye-bye.